Hey everyone, I'm Anastasia. This is Coffee Chat with Anastasia at Chicago Midwinter. My guest today is Dr. Josh Austin. I want to thank you for joining me.
Absolutely.
Clink.
Happy to be here.
Hey, what are you drinking today?
I am drinking black coffee. I'm a man.
You are a man, so you've never added anything in there.
Yeah, maybe a Splenda every once in a while, but no cream, nothing, no sugar, nothing like that.
Because you can handle the taste.
I think people who like a lot of coffee creamer don't actually like coffee, they like coffee creamer.
In moving along with that, we've got a product that Dr. Austin uses in his practice in Texas. Where is it in Texas?
San Antonio.
Okay. You can use this in your dental practice, like for CAD/CAM, photography, X-rays, or you tell us what you use it in.
Yeah, so it's really great just to get the lips and cheeks out of the way for prepping, for delivering like veneers or anterior crowns. It's great for pedo, to just kind of get everything up and out of the way. Sometimes, their lips tend to not want to cooperate with them, especially when you get them numb and they've never had that feeling before.
Right.
So anything really where I'm working anterior, photography, it works great. Scanning, it works great for any restoration. So there's a lot of different applications for it. And I find myself pulling the OptraGate out frequently.
Now, in doing that, do you find it efficient to use? Was it easy to use? Was there a learning curve for your dental assistant or for you?
Absolutely. I mean, as far as a curve goes, no. I mean, once you put it in a couple times, it's you have it down. It's not, doesn't take much. It takes a couple seconds. It's up and going.
Now, this is different though for a patient, because I'm sure most patients have not had this placed before.
Right.
How do you introduce that?
Yeah, I mean, some of them have experiences with rubber dams or something like that, and so if they've had that experience, like, well, it's like that, but a lot easier, and kind of give that to them. And I just kind of say, hey, this is going to get your lips out of the way, keep them from drying out, and keep things clear, so you don't have to just hold open as much, and we don't have to hold everything back. And usually once it's in, it's really soft. It's kind of it's got like a really soft feel to it, and so it's very comfortable for them. Yeah, I'll let you hold my coffee.
Yes, you can demonstrate that.
Yeah, so it's quick and easy, and it just goes in really quick. It comes in different colors, blue and pink and clear, if you wanted to play around with that, and I find patients find it incredibly comfortable. I generally don't do restorative dentistry on kids that are less than 5 or 6 years old, so I find that at that age it's a perfect age.
Okay.
Yeah.
So like for sealants even or something
perfect.
like that?
Yeah, absolutely.
Okay.
Yeah,
so,
even my hygienist uses these.
So in doing that, how do you integrate that between, like, to say, I'd like to use this obviously in the practice?
Sure.
How would you suggest for any dental hygienist who might be watching, or any dentist who say, I'd like the hygienist to use this? What would you say? Yeah,
I mean, talk to your boss, talk to the dentist that you work for, and tell them, like, hey, I think this has a place in our practice. It would make my life easier. My hygienist use it for air polishing, right? Air polishing kind of makes a big mess.
Right.
But when you have somebody who's a heavy stain patient, there's nothing better than air polishing. Air polishing will really chap someone's lips. That powder is very dry, and people find that uncomfortable. You get their lips out of the way, it makes the process a lot easier.
Yeah, it does.
So that's generally where my hygienists use it, and sometimes in a real gnarly scaling and root planing case.
Wow.
Just to kind of, especially with a lot of anterior calculus.
Is there any that's really not gnarly?
Well, yeah, I guess that's true.
I mean,
but yeah, sure. But there's some that are more tenacious than others.
Okay.
Let's put it that way.
Yes.
Yeah. So in those cases, I think it works really well. So hey, if you're a hygienist and you don't have this in your practice, talk to your boss, talk to the person that does the purchasing and ordering in your practice, and order a box. They're very cost effective and economical, so it's not going to be a huge impact on the bottom line. And if it makes you more efficient, it makes your job easier, makes your ergonomics better. Let's see how this goes. Let's see. There you go.
Wow.
We're in and gone.
So thank you for making sure that we can give better value to our patients.
Yes.
We're able to see it, and it is more efficient, so that's something to cling to. Thank you.
Thank you.
Until next time, take what you learn and make a difference with it.